Over 22 million Africans are infected with HIV, and almost 2 million die of AIDS each year. The most lethal strains of malaria, which take the lives of 2,000 children in Africa every day, are found in Africa. Infection rates for tuberculosis, the leading cause of death for people with AIDS, are higher in Africa than anywhere else in the world. Africa has been impacted much more by these infectious diseases than any other continent.
You can describe it in numbers: 1 million people dead, at least 1 million people HIV positive in a population of 30 million. So you are talking about close to 10% of your population either dead or infected. Or you can describe it that 10 of my own relatives died of HIV and AIDS.
Africa's problems are intensified because of one major challenge. There is a shortage of over 1 million healthcare workers in Africa to meet the needs of its over 1 billion residents.
It's a very big crisis. I mean, looking at within Uganda, for example, in the last census in 2002, they actually said that we had only about 5,800 qualified health workers. We're planning to go right up to 98,000 by the year 2020. So there's a huge human resource for health gap that needs to be filled.
The answer lies in not only education and training, but in a global commitment to building strong healthcare systems in Africa. A strong, thriving healthcare system that is African-owned and African-led will allow Africa to better meet the challenges of today and tomorrow. Accordia Global Health Foundation is helping to prepare a new generation of African healthcare leaders to meet the challenges of a continent in the midst of a healthcare crisis.
And our vision is to train thousands who in turn will train tens of thousands who will care for millions. Since we started, we've now graduated over 5,000 healthcare professionals in the treatment of infectious diseases.
In 2004, Accordia Global Health Foundation, in partnership with Macquarie University, Pfizer Incorporated, and the Academic Alliance, created the Infectious Diseases Institute in Kampala, Uganda. In just over 5 years, IDI has become an internationally recognized center of excellence, helping to build healthcare capacity in sub-Saharan Africa, as well as patient empowerment by teaching entrepreneurial skills and encouraging patients to be active in the care process by encouraging others and teaching prevention. As a result, hundreds of thousands of men, women, and children are living healthier, more productive lives and building stronger and more stable communities and nations.
Once that passion is ignited to make a difference to others' lives, you have a lot within you that you can bring to the table, and IDI has enabled the passion of many individuals representing many institutions to come together to make a difference in other people's lives.
Here, world-class research is underway with teams of global investigators. Healthcare professionals from across Africa are trained in advanced diagnosis, treatment, and lab services. Rural and urban clinics and hospitals are strengthened through programs that help to build infrastructure and recruit and train doctors, nurses, and clinicians. Advanced care and treatment for infectious diseases is given to more than 15,000 patients each year.
Drugs, counseling, yeah, they do that a lot, and it means a lot. Actually, the counseling part means a lot to my health. I really like IDI, its values, its commitment to the patients. Where I was, they had no outreach activities. So these clients actually feel supported when we visit them in their homes. Apart from seeing them at the clinic, we want to see their environment. We give them drugs and we tell them go and take.
We've trained 5,000 individuals who have gone out to train others, who have gone out to care for others. And so we believe that IDI has touched the lives of at least 1 million people on the continent through its care programs, through its training programs, through its research programs.
In addition to its partnership with IDI, Accordia Global Health Foundation has developed effective models for training healthcare workers throughout sub-Saharan Africa. including an innovative training program for mid-level practitioners and an internationally acclaimed training program in malaria diagnosis and treatment.
We've partnered with IDI over the years to implement and really evaluate these training programs, which we think is where we add some significant value to others doing the same kind of work. We actually have evidence-based to support the impact of our training programs and show that as a result, patients receive better care and they live longer and healthier lives.
The training that I've received in terms of just clinical aspects, research and mentoring is something that I hope to pass on to the younger people that I teach, the medical school, and hopefully inspire them to know that you can stay home and still be able to get involved in things like clinical research, clinical work that will hopefully keep you in your own country.
By linking internationally recognized academic physicians with emerging African researchers, and by supporting the next generation of African researchers through postgraduate infectious disease-focused research programs, Accordia Global Health Foundation strengthens innovative research capacity in sub-Saharan Africa and has both an immediate and long-term impact on the region's health outcomes. Better prevention and diagnostic tools have been created, new treatments have been developed and are now widely available, and over 1 million lives have been saved by U.S. investments in HIV/AIDS programs alone.
Well, I think this alliance has worked magic. We've created what I believe to be one of the most outstanding centers of excellence in all of Africa for infectious disease research, training, and care. I think that this group is unique. I hope to see this model replicated. It works, and I think it serves as a beacon of hope for all of Africa.
It has really given me courage that there is hope to live, and by so doing, I also have found myself also encouraging others.
Accordia continues to work closely with IDI to build Africa's capacity to deal more effectively with infectious diseases like HIV/AIDS, malaria, and tuberculosis. At the same time, Accordia has begun working with other African medical institutions to expand their ability to train the next generation of healthcare providers and leaders, to conduct research that will lead to better treatment for patients, and to provide advanced care for patients across the continent. Ultimately, Accordia Global Health Foundation envisions the creation of a network of centers of excellence, like the Infectious Diseases Institute, that can transform healthcare across the African continent. For more information, visit accordiafoundation.org.